Welcome to another episode of the program Easy Access to Healthcare for All, a program that brings you the strides of the National Health Insurance Scheme as it pursues its mandate to attain universal health coverage by 2030. In achieving this all-important goal, structure plays an important role. All the offices across the states of the Federation are carefully coordinated towards one vision. How is this done? That is what we shall be discussing on our main segment of the program. In our stakeholders segment, Dr. Phillips Uche Ekpe, a visiting consultant at the Guinea Savannah Medical Centre, is our guest as he speaks on the National Health Insurance Scheme. All of these and more in this episode of the program. My name is Aisha Muhammad Ahmed, welcoming you to the program and urging you to please stay tuned.
Easy access to quality healthcare for all. NHIS.
First on the program is a highlight of events around the NHIS, and our top story is the award given to the NHIS boss by Stardom Global Television. Keep watching.
The Executive Secretary of NHIS, Professor Nasir Muhammad Sambo, has received the Doyen of Public Health Award at the Stardom Global Awards 2021, which held on Tuesday, December 14, 2021, by the Stardom Global Television in Abuja. The award was conferred to him in recognition of his immense contributions to the health sector. In her remarks, the General Manager, SGTV, congratulated and appreciated the awardees for their diligence in the discharge of their duties. She added that it is in that light that SGTV recognizes them.
It is very pertinent to us as SGTV that we recognize the altruistic acts of these individuals rather than allow them go unnoticed. Hence, the need for the SGTV Man of the Year award.
In his response, the Executive Secretary, Professor Nasir Sambo, appreciated SGTV for recognizing their efforts and promised to give his best for humanity.
So I want to thank you for this award, and this award will continue to support us to do a good work for Nigeria until everybody in Nigeria has access to healthcare delivery services.
Other recipients of the award include Professor Nasir Na'Allah, VC University of Abuja, Akisani Falaki of Keystone Bank, Honorable Abdullahi Adamu Candido, AMAC Chairman, Dr. Abdul Jimo, and many others. The Chatham House, in collaboration with the Federal Ministry of Health, held a one-day Universal Health Coverage Summit on the 16th of December 2021 in Abuja. The summit theme was Putting Health and Health Security on the Political Front banner. The program had in attendance key stakeholders in the healthcare sector.
Estimated economic benefit.
Speaking at the summit, the Executive Secretary of the National Health Insurance Scheme, Professor Nasir Muhammad, touched on issues ranging from the National Healthcare Act, basic healthcare provision funds, NHIS Getaway, amongst other issues. He stressed the need for investment into the health sector.
We have to invest in healthcare, and if you fail to invest in healthcare, you will be caught with a situation whereby you have to spend 10 times the money if you are into problem. And we have seen that very vividly in COVID. If we had invested our resources in effectively in the healthcare delivery services, we wouldn't have spent over 900 billion naira. And 900 billion naira that is so expended now has not even in a way go into addressing the fundamental problems of the healthcare delivery system.
Professor Sambo also gave a rundown on how the Basic Provision Fund will boost universal health coverage, as it will cover both the aged and the vulnerable.
The advent of Basic Healthcare Provision Fund has catalyzed establishment of state health insurance agencies and has stimulated the states who have been in slumber in the area of health insurance to wake up. So this is a very good advantage because of the basic healthcare provision fund. It has also provided, it has so far provided access to over 500,000 indigent in the country, which leads to financial protection. Never in the history of Nigeria we have had this kind of opportunity, whereby vulnerable segment of population are coming under the spirit of human right to be getting services. And if we do basic health care provision, if we get it right, I want to tell you that it will sell itself.
Other stakeholders at the event were former Senate President Senator Bukola Saraki. He challenged Nigerians and those in the corridors of power to take health insurance seriously.
Giving healthcare to Nigerians across the 6 geopolitical zones down to the state in a seamless manner is the goal of the NHIS. For this to happen, the NHIS is structured in such a way that every of its staff is involved in its operations from the head office, zonal offices down to the state offices. We spoke to Mr. Ayo Osinlu, GM Special Duties, who explains to us exactly how the structure operates. Let's hear him.
Easy access to quality healthcare for all. NHIS.
The National Health Insurance Scheme was established in 2005 to help cut down out-of-pocket payment expenses during the provision of healthcare. It has an organizational structure and culture that guides its operational processes. The scheme operates a 3-layer operational structure comprising of the head office, zonal office, and the state office. The head office is saddled with governance formulation and policies development. The zonal office, on its part, serves as the tactical and strategic force of the scheme. They supervise and monitor the activities and operations of the state offices, as well as carry out middle-level advocacy. The state's offices take charge of operational activities such as carrying out accreditation and reaccreditations, reconciliations, as well as quality assurance. The state offices also interface directly with enrollees of the scheme. This structure is designed to absorb every staff into its operations. It also helps the scheme to measure performances at different levels. The states and zonal offices fall under the Special Duties Department that coordinate their activities.
We'll be talking mostly about the state.
Mr. Ayo Osilu, General Manager, Special Duties, speaks on the mandate of his office and the reforms in the scheme as it applies to the structure of the NHIS.
Basically, is to coordinate the efforts and the work of our various offices in the various states of the country. There are 38 state offices that we have. Lagos being such a large environment, so I had to break Lagos into 2 and have 2 states there. And then the FCT, of course, regarded basically as a state. So there are 38 state offices that we run in our system. So from this office here, which I drive, we coordinate the efforts of these offices, we harmonize the activities, we monitor their performance, and then we evaluate the various activities and engagements in which they get involved in the course of our operations.
The FCT office functions as a state office catering to the coverage of enrollees around the metropolis. NHIS Coordinator FCT Barrister Greg Azubuke speaks on steps taken to increase coverage despite the FCT being a formal city centre.
First of all, understand that FCT is principally a formal sector city because it is the seat of government in Nigeria. That is one. So we've more or less captured that segment. But then as the city grows, Some other ancillary services also come into play, those who cannot be employed by the government, who are in private businesses. They are also Nigerians and legal residents, and therefore should also be covered. What we have done to cover them is that we develop some other programs outside the formal sector. For instance, we have what we call OPS, Organized Private Sector, whereby urban and semi-urban dwellers who are not in formal sector engagement can also key into the program. We also have what we call community-based health insurance, though it's not really in vogue right now. For instance, in places like Karamajiji and some other rural areas, communities come together, form a BOT that will now sort of take off insurance policy for the residents of that community. We have about 3 of them in the FCT.
Aside their various functions, state offices assist the state health insurance agencies to also actualize their goals.
The state health insurance agencies are new, both in terms of exposure, experience, and then the capacity of personnel driving them. So to a large extent, the NHS state offices represent some kind of a reservoir of capacity and the ability from which the state health agencies, the health insurance agencies are able to tap and then enamel themselves, empower themselves, enable themselves. So to a large extent, our state offices as NHIS are like resource basis in terms of capacity and competence and experience on the job for the state health insurance agencies.
One major goal of Professor Nasir Sambo is to decentralize the operations of the scheme to the states so that they can actively and effectively contribute to attaining universal health coverage.
Our objective primarily is universal health coverage, which is the situation where we can bring health insurance to the doorstep of every single Nigerian alive. And to do this, what we must pay regard to the fact that the huge number of Nigerians which will form the basis for universal health coverage in the first place, are located in the communities around Nigeria. You and I are based in the cities around the country, but we form a negligible fraction of the Nigerian population. The huge, overwhelming proportion of our population are in the states and in the communities. So to a large extent, if you are going to attain universal health coverage as quickly as we want to, and we are required to by the country, then we need to develop activities and build bridges and create channels that will give us access to where the huge number of Nigerians are. Health insurance is a game of numbers. So where the numbers are, per se, are in the communities around the country. So our state offices, therefore, are our operational base, the hub of our operations as an organization. So we therefore deploy our state offices as our tools to gain access into the communities around the country and be able to help us offer health insurance and then, of course, generate a early uptake.
One tool used to foster synergy and ensure that all layers of the NHIS operational structure are in sync is the peer review mechanism. It brings both zonal and state coordinators together to share ideas and provide solutions to issues bordering the operations of the scheme.
We have the opportunity to gather in this place to review our processes, to review our business processes. Over the year, as we are trying to consolidate our rebranding and strengthen the organization through a decentralized operation, giving more powers to the states to be able to take fundamental decisions on implementation. We now bring them together and we are discussing the new business processes in detail so that every state coordinator will be conversant with the new business process of the National Health Insurance Scheme.
The platform of peer review gives us an opportunity to enable people share experiences, and then share understandings, and then share strategies and share ways and means by which they had gotten around some of the challenges. In some instances, some persons may be able to deal with some issues a lot more effectively than some other persons. So those who may not have the strategy that some others have can now learn from those who have been able to develop and generate the capacity and strategy for dealing with issues.
It's one of the things.
At a recent peer review meeting, states and zonal coordinators shared their views on the peer review meetings amongst other issues.
It's one of the things that we've been agitating for in the past, because we realize that at such forums, it's always better because a lot of people will bring in ideas. People stay in the head office and sometimes they don't know what happens in the field. But now that we have this meeting, which is a peer review, the field experience can actually come, and then the people that are designing policies at the top will actually know what is really going on at the level of the states and the zone.
The quarterly meeting is an excellent development, actually. So it's an avenue of coming together, discussion, bringing, it's part of the decentralization process of the reforms, whereby now activities implementation goes to the states. The states will be driving activities. So this is a very welcome development because it is an opportunity for the management to come together to sit with the state coordinators who will be running the process, to come and see and hear firsthand how are things being done, what are the problems, what are the challenges, and how do we nip them in the bud so that we don't have complaints anyway, so that we'll be able to run our programs effectively.
It's a very nice thing because the manager will be able to know the impulse of the state offices, they'll be able to know the challenges and the problem we're facing, and the state coordinator will be able to know the effort of the management in respect to achieving the universal health coverage for all, and all the effort they have been making to make things available to us so that we perform our job with ease.
Still, as part of the reforms introduced by the management of the NHIS, the scheme experienced a massive reshuffling of staff. Mr. Ayo explained the rationale behind the move and how this will help the agency towards attaining universal health coverage.
The reforms of the administration of Professor Mohammed Nasir Sambo significantly has as a key element professionalization. There is an agenda to professionalize the scheme, and to a large extent it's been found that staff had not been positioned and placed on tasks and on assignments in the scheme and posted around the country in the scheme's offices in accordance with the academic and professional exposures and trainings that they have had, with which they had come to the scheme. So we felt that therefore it's been, number one, a waste of capacities not to let people operate in areas where they are trained for, and then in areas where they have obvious capacities for. So what this posting has done largely, therefore, is to enable us to post people to areas where their training and their exposure best prepare them to give their best.
Welcome back from that break. Easy access to healthcare continues with our stakeholders segment. Healthcare providers are an integral part of NHIS. They serve as intermediaries between the scheme and enrollees. They are the first contact with enrollees, while NHIS serve as the mother body that regulates healthcare providers. The HCP receives its capitation from NHIS through the HMOs quarterly. In this episode, we bring you excerpts from our interview with Dr. Phyllis Uche Ekpe, a visiting consultant with Guinea Savannah Medical Centre, Garki, in the city of Abuja. Dr. Phillips expressed his views on the importance of the scheme, which is to make health insurance accessible for all Nigerians, especially the vulnerable.
Well, the National Health Insurance Scheme actually is supposed to be a very good project because, health insurance is the way to go, where people have to pay minimally without suffering in order to access care. The basic thing every citizen of this country needs is health insurance, good health, free health, possibly. And the aim of health insurance is for those who have money to be able to pay so that those who cannot afford it are able to access care at any point in time. Also, those who have money can also access it. But, what we're trying to say is that it's not the whole population that is going to be sick. Maybe some 10% of the population, while if 100% is paying, those 10% will benefit without having to say, oh, I cannot go to the hospital because I do not have money.
Dr. Phillips speaks further on the ease of accessing health care with the help of NHIS.
I've experienced some persons who do not have the money to pay, but because they are enrolled in NHIS, they are able to access care and get some level of treatment, at least some standard treatment. I won't say suboptimal, but some standard treatment. And then I will not say it's very optimal, no. So it's helping, but it needs to be supported. It needs to be helped for it to do better. There is need to expand it and involve every sector. There is need to begin to say, look, if you do not have health insurance, you cannot have driver's license, you cannot have international passport, you cannot open an account, With that, I think there will be more money to run the healthcare system.
Healthcare providers as well as health maintenance organizations are critical stakeholders in NHIS. Dr. Phillips speaks on their relationships as it affects healthcare delivery.
Well, I can say that HMO referrals has been fair enough, but not so fair. There are just very few HMOs because we don't want to advertise or, would have called names of those HMOs. I can tell you there are not more than 4 or 5 HMOs who are putting in some level of quality to achieve best practice.
Speaking further, Dr. Phillips highlights some of the challenges confronting the implementation of NHIS.
And of course, that there was also a repeal and reenactment of NHIS bill, which is currently on the President of the Federal Republic of Nigeria's table for assent. So this is an opportunity to appeal to all the persons of influence and to reach out to the President of the country to be able to give assent to that wonderful bill so that, healthcare can be funded even by the people. Government can fund healthcare alone. That bill helps the healthcare to be funded. So that is that. We also think that the HMOs and NHIS have the objective. They have to go into the market and look at cost of things. Look at, they can take actuarials. How are the hospitals running? What about rent? What about staff salary? What about those things? So that they make sure that the tariffs, are acceptable so that those hospitals can survive.
That was Dr. Phillips Ekpe of Guinea Savannah Medical Centre, Garki, Abuja. We will now take your questions in this last segment of the program.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled?
How can I get enrolled?
Question: what is the giftship program?
It is supposed to be an all-encompassing program that will cover G group of people, I individual, and F family, who are not employed within the formal sector, but they are either employees of the informal sector or they are self-employed, provided they are earning salaries, they are earning income, and that income is sufficient enough to pay premium and get into the social health insurance ecosystem.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
I think I paid almost nothing.
It went easily. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
Easy access to healthcare for all every Saturday at 8 p.m. on the NTA network service.
This is where we draw the curtains on this program today. If you have an issue or complaint as an NHIS enrollee, visit your state office. The NHIS is structured to meet you at the point of your health needs. Join us again same time and on this same station for another interesting episode as we continue to bring you more stories of happenings around the NHIS. Enjoy the rest of your day.